Good morning and welcome to your COVID Talk with local health authorities. I'm Stephen Williams, Director of the Houston Health Department. With me I have Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. This is sponsored by Rotary Club of Houston. Thank you to past President Kathy Finninger, who provides us with questions. School is really a hot topic now. The first question, what are your thoughts about bringing pre-K back and not older students, at least for first?
Well, my issue is the age of the student isn't the problem. It's that it's a mass gathering, and so I don't know that pre-K would be treated any different from any other age group.
Yeah, I agree.
Please explain, within Harris County, can the county judge order superintendents not to open schools in person? She is currently using the word should. Can this be enforced?
Well, so the way the governor and the state have put out guidelines, they've actually said that the health authority can actually issue the orders. So it's actually from a local health authority standpoint. Now we actually wish that this could have been at the state level because it would have been more consistent across the state. But right now the way it's worded from the state, it looks like the local health authority with some oversight by Department of State Health Services, that's also written, but the health authority can issue those orders.
Since you're both health authorities, and I have a question myself. Is it consistent with your normal practice to issue an order before something actually occurs, or?
Yeah, that's a good question. So usually, and I have to go back to see how the law is written, but usually it's been when something has occurred. So once somebody is infected and you write an order to control them, or once a location is known to be dangerous, then you would write the order to control that. But here's a different situation because you can see the danger coming, right? So to wait until the danger is actually occurring is to some degree to be irresponsible and shirking your duties. And so,
yeah, and you could also make an argument that you have enough transmission in the community. That is, you're saying these are mass gatherings of some sort, that you can actually do something in advance to say we think this is going to further exacerbate the issue.
I mean, our responsibility is to protect the public, and so we see an imminent danger, you've got to take action. It's just sort of the same as probably a bad analogy, but when you know somebody's about to do something dangerous, the police, they act before they hurt the second person. You don't wait for the stabbing to occur before you stop the stabbing, right? I mean, maybe a bad analogy, but when you know there's something dangerous about to occur, you have a responsibility to act.
Well, it's the other way of looking at it is maybe the speed limit, right? So we put these limits in place because you're concerned if somebody goes above them, there's going to be some danger to that. So that you could, if somebody goes above it before they actually get into an accident, an officer may still pull somebody over and say, look, you're going above the speed limit. The whole reason is because you don't want them to get into an accident or have another issue. So a consideration in that way. There are many metaphors to put it together, but I think the bottom line is our job right now has become very difficult because the pandemic has been so overwhelming across the community that really we have to do whatever we can to try to enact issues and policies that will allow us to protect our community.
I saw a note from one of the counties in Texas saying that they were probably going to issue orders, but they're doing it in concert with and I guess in consultation with the superintendents. How is that going to play out here?
Well, we've been in consultation with the superintendents. I know the mayor has and the judge has, and both you and I have. So we've already been in consultation. And now the issue is that in the greater Houston area in Harris County, there are many school districts, there are many ISDs, and in addition to that, you've got the non-ISD schools, the parochial schools.
That's right. Yeah, I think that from the ISD standpoint, there are, I think what makes Harris County so, one, incredible, you're right, fantastic, but also the challenge is that we do have so many school districts. We have 20 plus. So everybody focuses on HISD, but there are so many other school districts here as well. And then there are some school districts that actually overlap into Fort Bend County, Galveston County, Chambers County, And then we've got a lot of, obviously 34 cities within Harris County. There's just a lot of real confusing overlap between all the different jurisdiction lines as well.
So will you treat it like we treat other diseases, or is this going to be different? I know that between the health departments, we actually shift responsibility for cases relative to jurisdictions. How are you going to deal with this, the overlap?
Well, I think we're going to try and be in as lockstep as we possibly can, because it makes no sense for the city of Houston to have one set of rules and Harris County to have a completely different set of guidelines or rules. So we're going to try to be in as. Now, there may be times when there's a good reason why we're a little bit different, and when there is, we'll do the right thing, and then we'll articulate why they might be a little bit different. And that's not new. We've done that before too.
Absolutely, and you know, Stephen, you know this, that you know you've been a part of this conversation. We've said so many times we don't have to always be the same, but we have to be consistent. And our diseases don't know jurisdictional lines, and certainly people go back and forth, and in this case, kids who are obviously in different schools, but they obviously have parents that are going back and forth. There's so much that is really overlaid on such a cosmopolitan community as we have, but working together is the only way to do it.
Okay. If teachers are considered essential workers, what are their rights about returning to work?
That sounds like a good lawyer question.
That's a great legal authority question than a local health authority question. Yeah, I don't know about the rights, but I will say that we all have a responsibility. If you're a business owner, or if you're, you know, in this case, a school district, if you're a governmental agency, we all have a responsibility at this time to really help not just protect our consumers, our customers, or children, but also the people that are actually providing that activity, and in this case the teachers, as well as other staff and faculty. So there is a responsibility. Look, I also have to give a lot of credit to our school. I mean, same here, you know, all of our school districts. Everybody is struggling to do the right thing. There is no school district, regardless of which direction they're falling, that is saying, I don't care about the health or safety of children or faculty. Everybody does. That doesn't mean that everybody's landing in the same place, but all of us know how important this decision is, and we have to give a lot of kudos to our school districts, our administrators, our teachers, and ultimately parents and children as well.
So when should schools open back up?
Well, the recommendation in our letter, the Harris County letter that Judge Hidalgo and I signed on Monday, was that we thought the recommendation should be in October. That said, the question that was earlier on the table is, can we compel? And I would think that if you compel, you have to really come up with a date that is going to be consistent with what's happening with all the information you have, but that may be different than what the recommendation is in the letter. It may be sooner, and also to say that you want to take that in lockstep with having an understanding of what the independent school districts are really doing as well.
Yeah, I would answer a little bit different. You gave a date because that's what's in the letter. When it's safe for the schools to open is when we as a community have got this virus much more under control than it is today. And every one of us can participate in that. Every one of us can contribute. Whether you want the schools open or you want the schools closed, especially if you want the schools open, then we need to do everything we can to get this virus under control. It's not under control now, and that's what makes opening the schools a dangerous thing to contemplate.
And so
thank you for joining us for the COVID-19 Talk with Local Health Authorities. We'll be right back.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to the COVID-19 talk with local health authorities, sponsored by the Rotary Club of Houston. Whoever wrote this actually has been reading my texts, I think, from other health directors around the state. Is the CDC looking at symptoms now versus test results to determine who should quarantine?
Yeah.
There's been going a lot of back and forth about that. So.
Yeah, so the science has been evolving, and so the CDC did recently change the recommendation, and they are now pretty much very much downplaying the testing option to return to work, and really going with the symptom one. And in fact, they've changed that a little bit too, so that it had said that you need to have 3 days of decreasing fever, and then at the end of that 3 days, that had to be at least 10 days from the beginning of symptoms. They've actually now changed, so you only have to be 1 day without fever, but it still has to be 10 days. And so that's a bit of a significant change. Now what bothers me, and maybe you guys, they didn't really give the rationale for that change. So I'm waiting for it, because they usually do. The CDC usually gives you like what they're basing that decision. I didn't see it this time. Do you know?
I didn't see it, but I do think that there was some comment made about the availability of testing and the delay in testing results coming back, which is, we all know, has been a real gum up in the entire system. Is test results are coming back at times so late. I mean, some of our the FEMA testing sites, the federal sites, testing is coming back 10 to 15 days later still. And you know, when you're fighting a pandemic, time is of the essence. And when you don't get a result back for 2 weeks, one, the individual is waiting for 2 weeks, and number two is that you have a health department not able to do what it needs to do to fight the pandemic. So I think part of the rationale is that.
So it's really based on environmental circumstances versus science?
Well, your symptoms, right? So you need to be, generally it's 10 days, and now with at least 1 day of no fever, and all of your symptoms need to be improving during that. In the last few days, your symptoms need to be improving. But it's a 10 day, and part of it is they found that beyond 10 days, now there is a caveat to this, it's important. Beyond 10 days, most healthy people, even though they may continue to test positive, are not actually infectious to somebody else. The other caveat, however, is that folks who are significantly ill or those who are immunocompromised, it's 20 days. So, because they tend to not clear the virus as quickly, and so it's a 20-day for those who are seriously ill or immunocompromised.
That's right.
1,000 TSA officers have tested positive. TSA appears to have safety protocols in place. So why this number? Are they not sanitizing enough?
I haven't seen that number, but I will just remind us that that's probably 1,000 across the United States, and I don't know over what time frame that is. So it's, sometimes
what is the denominator?
Right, exactly. So I don't know how many there are. Is it 30,000, 50,000, 100,000? And I also don't know over what time frame. Sometimes we hear these splash headlines, but then you feel like, oh, this must be 100,000 like in the last month, but it could be from March forward and accumulated.
The other thing to keep in mind, that is a very public-facing job, right? And so, while they may not be in a, they are in a mass gathering situation all day long. Like for the individual traveler, there may not be, they may be spaced out, but for the TSA worker, they're dealing with new people every couple seconds, right?
Right. It's almost thinking about it almost like a first responder, that they may have repetitive interactions that are going
But an
on.
extremely busy one.
Yeah. Now, one thing that is good that United Airlines yesterday just announced that it wasn't just you had to wear masks while you're on the flight, but they were actually putting some requirements into wearing the mask while you were still in the in the airport area to get to the plane. So I think those are kinds of things that would be helpful.
If the city of Houston has protocols for staff, how are essential staff becoming affected? Is it noncompliance by fellow workers or contact with citizens?
So, well, it's a bit of a challenge to know how somebody got infected, but since we have so much virus spreading throughout the community. And so their chance of becoming infected at work, in a workplace that is following the rules, is low. It's not zero, but it's really low. And so then the concern is, what are they doing in their non-work hours? And, when they go to the supermarket, is everybody in the supermarket wearing their mask and keeping apart? When they go to, do whatever it is that they do, or is everybody in that environment following the rules as closely as they are at work?
That's right. And that's a similar thing for nursing homes. We've had this question about nursing home staff. We've been asked the question, well, if they have such great protocols, why are there still cases that are happening in nursing homes? And the answer is that it's also introduction of virus that's coming in. So if a staff member, a nurse, or somebody goes back home and gets infected in the home, how do they come back and then potentially infect their fellow worker and/or a patient? And this is why Major League Baseball and football and all that, even with basketball and NBA and what they've done, they've actually created a bubble. So there's really, everybody's being tested and you can't go in and out without. So there's just a lot really that goes into what happens in community.
You and I had the case this morning, I can't remember the deal, but there's somebody who got infected by their teenage kids. So they were doing everything right, and then they got infected by their teenage kid who was going out and hanging out with his friends.
That's right. That's right. That's why we're all in this together.
That's right.
Okay, Jared Francisco, medical director of TIR, said practically every organ system can be affected, not by the virus, then by immune response. Is this true? Dr. Sinnert at Athens, Georgia, University of Georgia, I guess, cardiologist, said hospital beds there are full due to catch up in elective surgeries, accidents, and general illnesses, not COVID. Is this true? Actually, I read this in the paper. Right?
Well, we had some of that here. Where elective procedures and things like that. So when COVID-19 was getting better, elective procedures were going up. Now obviously the governor put orders in, so elective procedures have been going down, but the proportion of COVID has been going up. So I think you've seen some of that here, but your thoughts?
So two thoughts. One is I think that the medical director from TIR is right. It appears to me that pretty much any organ system can become impacted by this virus. It's one of the things about this virus that makes it so difficult. The second point is that hospitals are a business like any other. They're going to be running at about 100%. If you run the hospital, you want it running at about 100%. So the statement that the hospitals aren't full with the COVID patients, they're full with all these other things, well, that's true. So if you look in Harris County right now, right about 50% of all the ICU patients are diagnosed with COVID disease. And if you look at the general beds, the non-ICU beds, it's about 25% are patients with COVID disease. Now, a year ago this time, the hospitals are still full, but they didn't have the COVID burden. So half of the beds that were full with ICU patients, with COVID patients, last year, those were different people. And so that's what worries me is the people today who would otherwise be occupying those ICU beds, what's happening, right? And a lot of it is elective surgeries have been cut back and other things have been cut back. And so it's not just the direct impact of the virus, it's the collateral impacts of it as well, including, and we see that in the hospitalization numbers.
Okay, and this is a related question. On Harris County Health dashboard, it shows the confirmed cases and active cases. The active number seems to remain high for a long time, even though TMC data shows hospital stays are getting shorter. How does a positive case have to report in? So to take them off the list. Are you anticipating they will all get retested?
Yeah, well, some of it is about retesting, but some of it is actually about additional information when our epidemiologists reach out. Some of it is also about how long after somebody is infected and we get the results. So if, we are still unfortunately getting some delays in laboratory reporting, and so if you get somebody who's a month out, for example, that individual is likely going to be considered a recovered rather than somebody who is obviously actively infected. So it's a very complicated equation that goes into it.
Okay, CDC says the actual infection rate is 10 to 13 times higher than reported, and 44% are asymptomatic. So instead of 2.3 million in the U.S., the actual number is at least 23 million. Your thoughts?
Yeah. I don't argue with the CDC on that until we get a really good prevalence study done It'll be hard to know for sure, but I wouldn't be surprised if once those studies are done that it bears out what the CDC is saying.
Right, and you sent me that article just yesterday about the 10 cities across the community that across the country that had higher rates when you did the prevalence studies.
Okay, you've been joining the COVID-19 talk with local health authorities. We'll be right back.
Hello, I'm Mayor Pro Tem Dave Martin of District E. From Clear Lake all the way to Kingwood. Today I have a plea for my neighbors in District E. Mask up, stay home, wash your hands, and please social distance. On March 17th, the city issued a stay home, work safe order, and residents of District E did a phenomenal job of quarantine, which resulted in fewer cases of COVID-19. In May, the city started opening up testing sites, along with many businesses, and initially District E had flattened the curve with 1.6% of those tested coming up positive. Today, unfortunately, in District E, that number of positive cases has skyrocketed to 11% positive in less than 30 days. Citizens, friends, we need a wake-up call. While we may be on summer break, COVID-19 is kicking us where our mask should be. So let's mask up, stay home, stay healthy, and visit us at www.houstonemergency.org/COVID-19 for testing sites, information, and tips on how to beat COVID-19. God bless.
Welcome back to COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. Dr. Persse, you mentioned that someone could have both COVID and influenza. In the fall, should everyone be tested for both and perhaps strep also?
Yeah. So that'll be a clinical decision made by the physician treating the person, but it wouldn't surprise me that we see a lot of that going on. The best thing that people can do is once this season's flu vaccine becomes available, go ahead and get that flu vaccine, and that'll minimize your chances of being infected with those two viruses at the same time.
New research reported in JAMA suggests potential risks of male infertility as well as sexual transmission. What about issues for women?
I haven't read that one, so David, do you have
I haven't read it either, but it doesn't surprise me. Like we just said, this virus can attack any organ system.
Okay, this is on research and vaccines. Dr. Michael Mena of Harvard said technology exists to manufacture $1 home testing.
I'm not familiar with that one. $1.
No, but I will say that, you know, there are some price inequities when you look globally about how much testing is costing in other countries versus what it is here, and obviously a lot of supply chain issues, but just to put that out there as well.
Is ours more expensive?
Probably compared to other countries, yes.
We're still on vaccines. Oxford University and AstraZeneca vaccine is set to become available September 2020. What does that mean for us?
Well, first of all, there are a lot of pronouncements of what is going to be available, and until it's actually available, I'm going to hold my breath and hope for the best. But I think if vaccine does become available, I think to your earlier comment, it's flu vaccine and looking at giving COVID vaccine. Obviously, we'd have to know who that vaccine is going to protect, and so a lot of considerations. Right. But I'm doubtful September is going to be the time frame.
Yeah, it's early. That'd be early. Yeah.
Still on vaccines. And the vaccine race, should their makers profit? Two companies said they would sell their vaccine at cost, though one who received large federal funding said they would not. That's been an ongoing issue.
Yeah, that's kind of a policy decision. I mean, I think that the right thing to do is to, I mean, they're still businesses, so if they make a little bit of a profit, I'm not going to have too much heartburn about that. I really think that there should be no gouging, absolutely, and we need to sort of define when you get from making a little bit of a profit to gouging. Ideally, they would do it at cost, but I'm a realist. I don't see that happening.
Okay, true, false, and short comments if you want to. And this is from last week. There are less people smoking or vaping because they know smoking is a risk factor.
True or false that that's the case, or
Yeah,
we're happy to see it? I'm happy to see it.
True or false?
I don't know if we know if it's true or false.
I don't know if it's true or false.
We don't know that it's true. If you test positive, it could mean you have antibodies from an infection from another coronavirus, like that of the common cold.
It depends on what kind of testing you
depends
have.
on-
If
right.
it's antibody testing, yes, but if it's PCR testing,
And
no,
even with
no.
the antibody testing, you need to know which
That's right.
antibody test you're getting done.
That's right.
So some antibody tests are specific for.
Yeah, so the rule of thumb is if you get an antibody test where they stick a needle in your vein and it goes into a test tube and goes off to a lab, that's very specific generally for this coronavirus. If you get the finger stick one, some of those are specific, a lot of them are not, and you will get a positive. You run the risk of a false positive from the common cold coronavirus.
Transmission from a child to adult is less for COVID than for flu.
I don't know that we know that yet.
Yeah, it's too early to say that.
Kids should wear masks if they return to school in the fall.
Yes.
Oh, yeah.
We got it true finally.
Yeah.
We're still in the first wave of the pandemic because we have not returned to the baseline.
I think there's you can make that argument. I mean, some people say this is a wave 1A, 1B versus being in the second wave. We're still in that first wave.
Yeah, I'm still calling what we saw in February, March a ripple. This is our first wave. Because what we saw earlier, that was real. It was so small compared to what we're dealing with now.
Yeah.
COVID prefers dry air.
I don't
think so.
Think so. Yeah.
Yeah.
No, false.
The number of hospitalizations is more important than positivity rate.
Well, it's apples and oranges.
Yeah, I would say false because there is no more important right now.
Right,
All those need to be taken into consideration.
I agree.
So I was good in medical school on the ABCD.
Last week, Mayor Turner asked for a 2-week shutdown, but this week he said we need to dial things back. Does that mean things are better?
So it depends on how you look at it. In terms of hospitalizations, the numbers are about 1% better. The number of total hospitalizations is down about 1%, right? If you look at our positivity rate, it's still very high. If you look at the number of new cases every day, it's still very high. So, no, I don't think it's under control, and I think we need to be aggressive in getting it under control.
Okay. Houston hospitals are in the secondary ICU surge plan, but normal admission rates are down. Will the Army Task Force be actually used, or will the extra facilities be unused like in New York? Isn't the transferring patients to different parts of the city like those who are almost gone, ready to go home, subjecting them and others to unnecessary contact?
Yeah, so that's a long question. So right now the hospitals, even the different hospital chains are doing a good job of balancing patients across hospitals in a way like they've never done before. And so that's good news, and that's trying to make the most for everyone. But today, if the Army came in and put up a big hospital, we wouldn't use it. We wouldn't need it, not today.
That's right.
Last week we talked about medical resorts. Are family members permitted to visit?
I believe not.
That's right. Yeah. I agree.
On average, how many Houstonians are tested each day? 1 minute.
Well, across Harris County, we have about 15,000 tests, if I have the number correct in my head, that are occurring per day. Yeah.
The eviction moratorium is being lifted this week. I can't return to work yet. Will this protection be expended? We don't really know that.
I don't know. Yeah.
The quilt show will have 55,000, was canceled at the end of October, and Nutcracker Ballet has gone through December. How far out should we cancel events that are planned?
Yeah, so that's a difficult question because it takes so much for those big events. There's so much pre-planning, and you're spending money as you're entering in contracts and stuff. And I think that's why because at this point, well, it's a couple of things. One is, well, hopefully we'll see this wave get better. But there's always a second wave.
That's right.
And that'd be probably in November, December, January.
I would say that you should plan on virtual, and then you got to be ready to go with Plan B very quickly, virtual. So those are the kinds of considerations that need to be put in place.
Thank you for joining our COVID talk with local health authorities. Dr. David Persse, representing the City of Houston. Dr. Umair Shah, representing Harris County. This is sponsored by the Rotary Club of Houston. I'm Stephen Williams, Director of the Houston Health Department.